following portion of Daytime Tri-Cities is sponsored by Changes Medical Spa and Laser Center.
Well, we are here at Changes Medical. We've got Dr. Angela Shelton joining us, along with Dr. Richard Jackson, the medical director here. Thank you both so much for having us out.
Thank you.
Talking today about an innovative new treatment that is having amazing results. It's called EXOMIND, and you guys are having incredible success with this, as well as others. Tell me a little bit about, first of all, your background and how you got into this medical mental wellness.
Okay, well, you usually don't find this at a spa, but what a lot of folks don't realize about us is that our backgrounds are fully in mental wellness, mental health. Dr. Jackson's been board certified by the American Board of Psychiatry and Neurology for over 40 years. I'm a psychologist by training with over 40 years experience, taught at the University of Tennessee for 20 years. And so when we opened our spa, our medical spa, we wanted to focus on both wellness and also laser. So technology, and this kind of brings all that together. It brings technology with mental wellness.
And you guys are one of the very first providers in the entire country to have this technology.
There are very few at this point.
Talk to us a little bit about EXOMIND. What is this?
It is a newer version of transcranial magnetic stimulation, TMS. And what has been found about brain function, and has been known for a long, long time, is that there are particular areas of the brain that stimulation of those areas can improve functioning in a lot of different ways. So the treatment puts magnetic pulses into the dorsolateral prefrontal cortex. It's a very specific area. And through doing that, it stimulates the brain to have increased plasticity, neuroplasticity between the areas, and also to kick out a variety of different issues people may be having.
And then, Dr. Jackson, how is it different than the traditional TMS?
Well, it's a unique device, and we like treatments that work, and this is one that has some unique characteristics compared to other TMS devices that are currently approved and have been available over the last 10 years. One of the things that BTL, the manufacturer, has designed it to be able to do is to provide more effective treatments in a shorter amount of time and with a shorter number of treatments compared to other devices. So that can reduce the cost of the treatment a great deal, and our goal with it has been to make it competitive in terms of the cost to treatments that are covered by insurance. Often it will be less than that, although the amount that insurance pays for other devices can vary a lot. There's generally a high copayment, and the number of treatments that are required with traditional TMS are something like 30 to 36 treatments over the course of about a month or 6 weeks, whereas the initial series of treatments with EXOMIND is typically about 6 over the course of about 3 weeks.
So a big difference.
And that can vary
difference.
depending on the patient, the patient's condition and the severity and how quickly they respond. But that's at least an initial number of treatments, and for some people they may need maintenance treatments
And the cost,
at a lower frequency.
The cost comparison with current figures for EXOMIND, typical cost is about $3,500. Right now, our cost to the patient is $1,999, so a little less than $2,000. A traditional TMS course of treatment for 36 treatments runs people, even if they have insurance, runs them anywhere from $6,000 to $9,000. So it's a significant time savings there. We have psychiatric patients that have been coming here for over a decade, some of whom come from pretty far away. We have one that flies in. So when you're talking about daily treatments for over a month with traditional TMS, that just becomes not an option for them. Whereas coming in a couple of times a week for a few weeks is much more doable.
And side effects are minimal. Most people don't have any side effects. Some people may have a little bit of headache or drowsiness after a treatment. Most people are fine with going back to normal activities after a treatment, which lasts about 30 minutes. And typically the treatments are done a couple of times a week. Once a week is possible for many people.
Amy will have more from Changes Medical Spa and Laser Center after the break. You're watching Daytime Tri-Cities. Stay with us. The preceding portion of Daytime Tri-Cities was sponsored by Changes Medical Spa and Laser Center.